So I just want to say at the beginning that social justice is a huge objective for all societies. There's a big literature out there on social justice, starting many centuries ago. And I think does anyone know what social justice means? I mean, how would you describe it? How would you talk about it? I think it's the ideal of equality. Equality among people before the law, equal opportunities to the benefits of society, equal opportunities to grow, to develop capabilities. And I think all societies do aspire to some measure of social justice, even if that is challenged severely by political regimes from time to time. But at the same time, I think it's important to recognize that gender is one such cleavage along which equality can be denied. Now, in terms of the objectives, I think there are just two broad objectives to pack really what gender means, what equity means, what social justice means, and how they relate to each other, and to understand how and why these terms matter for health systems and policy research. As I said, gender is a big source of injustice, and so in today's in the next hour or so, I'll focus on why and how it works. And in doing this, I'm drawing on two big sources of influence in my own life and in my own work. So these are two books which were sort of 5 years apart. And one of them, the one on the right, which is the final report of the Women, Gender and Equity Knowledge Network. It's in your list of essential readings, and it's up on Moodle. Is something that you can sort of draw upon. It illustrates and it specifies very clearly how gender equity works and what can be done to reduce it. So let's start. I know in traditional, sessions on gender versus gender, you usually start with the question of, is gender the same as sex? And I'm raising it again, not because I want to, follow what everyone else has done, but because it's very critical, I think, to the question of health. So sex is biological. You have chromosome-linked anatomical, physiological differences. And there is something called the karyotypes, which is the arrangement of chromosomes within a cell. And typically you have a certain arrangement for females and certain arrangements for male. Now, however, it's come to be known that there are those that are not the 46XX or the 46XY, and these typically refer to what is called intersex persons. So there are questions around what gender means, and we'll address some of that a bit later. What's important to know, however, is that while sex chromosomes cannot change, you're born with it, you have it all through your life, but there are other aspects of biology which have to do with the sex hormones, which has to do with reproductive organs, which have to do with secondary characteristics, etc., which are open to change. So it's through puberty or menopause, those things can be altered through either individual actions or environmental exposures. So it's not as watertight or cast in stone as I thought initially when I first started looking at the gender literature. So as you said, gender is social. So these are socially defined relationships of power between men and women. Now, would somebody like to tell me what that means in terms of how would you describe a gender system? What features would come to mind immediately? If you think of gender as social, and now I've told you, well, these are defined relationships of power between men and women. And that's the material basis for gender in a way, that you have unequal, that men and women have unequal access to resources, and these can be both material and non-material. So examples would be, you know, income, assets like land ownership, sources of credit. You know, a lot of credit networks are predominantly male, only male access, you know, the access is through men in the house. But it also, as someone said, decision making, so voice and say in decision making, time, etc. Now this in fact forms the basis for unequal access and control, unequal power, unequal authority, and that forms the basis in turn for defining and distinguishing male and female behaviors, expectations, roles and relationships. So by this I also mean things like the divisions of labor, mobility. Is it appropriate for a woman to go out on her own, you know, unaccompanied after dark? What are the divisions of labor, you know, between men and women, among women, you know, among men? As well as notions of masculinity and femininity. So, you know, in the public health literature, a lot of it focuses, for example, on risk taking by men, because that is seen as being very masculine. And here you find, you know, that the mass media or, you know, a lot of the other media play a role in shaping ideas about what is masculinity and what is femininity. And all of these in fact link back to the material basis for gender. Now there is a further layering of this system in terms of its legitimization. So the inequality is in fact legitimized by social norms, by values, by traditions, by all of this, and this is, you know, in turn internalized by both men and women through socializations. So, so norms of what it means to be a good girl or a bad boy, you know, are very much linked to this idea of legitimization and internalization. So while gender is something that works itself out in households and in families, they also play out in communities and in social institutions. So whether this is, you know, the educational system, whether it is the legal system, you know, whether it is medicine, the health system, gender plays itself out in many different ways, and through, again, you know, structures, practices, behaviors, norms, etc. Now the thing about gender, of course, is that it's not a fixed system. I mean, even within India, you would agree that the gender system varies. So between the north and the south, the northeast, you know, there are many different tribal systems. There are many different ways in which gender works, and between India and other countries as well. And neither is it the case that these are static over time. So even within the same society, there are a lot of changes over time. Now, one of the reasons why there's so much violence that's being reported by the media, of course, it's better reporting, but it's also pointing to shifting gender norms. From more traditional notions of what girls ought to do to what girls want to do and what reactions are there to their defining a different role for themselves. So gender norms are constantly being negotiated, they change, by no means are they static. I mean, a simple thing would be to go back to your own grandmother to find out how, you know, how she grew up, and compare it with how you did. Now, one of the big challenges, and it's linked to the intersex issue as well, is the challenge to gender analysis and to gender systems, which is all of the movement around, you know, the LGBT, the lesbian, gay, bisexual, transgender movement, which is becoming very much more articulate, very much more visible. And they are actually challenging the whole binary approach that's adopted in the gender system, which is between men and women. And they're saying, well, just as the gender system was in fact challenging norms of masculinity, the LGBT movement is actually defying and challenging notions of the heterosexual norms within the gender system. So it's really asking for more inclusiveness. It's asking for more recognition of the fact that this kind of social identity and position, in fact, is a very vulnerable one and is very open to violence and discrimination and bias, and therefore the gender system must take active cognizance of it if it is to be real in some ways. Now, what about boys and men? While the gender system while people who conduct gender analyses are very articulate about the way women lose out in such a system, it's also true to say that while men have better advantages, they are also more vulnerable in some ways, not more vulnerable, but they're also vulnerable, because there is a cost to their whole position emotionally and psychologically, and this is often translated into risky behavior, unhealthy behaviors, whether it comes to smoking, whether it comes to taking risks, whether it a range of things. Men are equally vulnerable. So in a sense, nobody is really exempt. Everyone is part of the gender system, everyone is complicit in the gender system, everyone is affected by the gender system, and being that as it may, it's really a big institution out there. So I'm really glad that there was a lot of feedback, and it makes me feel good that there is a certain, at least at some level, there is a basic sense of what gender means, because I don't think we can be completely blind to it now. It's not invisible. It has to be actively considered, and especially in health systems research, I think it's time that we brought gender more in, more center stage in everything that we do with the health system. Why does it matter? Because at many levels, I think in terms of research, it doesn't just tell you what the sex differences are. In terms of politics, it doesn't just tell you, who is marginalized and who is, made worse off. But I think understanding gender also helps to understand how this inequality is produced and reproduced and justified, etc. It helps you to see it sort of threadbare in terms of its norms, in terms of its values, in terms of what it's doing to people. And therefore, it helps you to sort of unpack how these systems of domination and power are being sustained and maintained. With other axes, now this is where we'll go into next. It would help to understand, okay, so who is valued for what, who decides, who does what, who has what, simple questions. And I think one of the hallmarks of health policy and systems research is the question, importance of asking the right question. And I think sometimes the simplest questions, in fact, reveal a lot and sort of yield a lot of very fundamental information. So in terms of health particularly, I think what it does, it determines whose needs are acknowledged. By needs we mean health needs, whether they have a voice over their own lives and health, whether women can realize their rights, and men too. Now the thing, however, is that, and this is where it can get a little complicated, is that gender does not function on its own. It actually interacts with class, caste, wherever it's relevant, race, with ethnicity, with religion, even life stage and age, which makes it very complex because what does one expect when you recognize that these are all intersecting axes of power? It simply means that there there are no predictable answers. One cannot fully predict what it means when you consider gender as an intersectional axis of power. But I think you should. I mean, there is complexity, of course there is, but then our lives are complex. Each of us embody, in fact, multiple axes, isn't it? So, what one would reasonably expect is that while gender is modified by one's class position, by one's caste, by one's religion, etc., the experience of class is also modified by gender. I'll give you an example. So, the traditional literature on class would tell you, for example, that there's poverty in poor households and there is lack of poverty in better off households. But if you look at this phenomenon through an intersectional lens, you would actually find that poor men don't have the same type of poverty as poor women. That barriers to access by poor women are quite different from barriers to access by poor men. Now the reason for this, and I'll tell you a little more about it, it's linked to the second point, which has to do with the fact that each of those axes of power, in fact, have some advantages and some disadvantages. So, for example, if you think of a social spectrum like that in linear terms, where you have, for example, let's take two axes to make it simple, where you have poor women at one end and you have rich men at the other end. Okay? In between, there are a number of different categories that you could reasonably find. So, there will be poor men next to poor women, there would be middle class women, there would be middle class men, there would be poor women and there would be poor men. Okay? So, if you think of a spectrum like that, now one could reasonably argue that a poor woman is doubly disadvantaged. She is poor on the class scale and she is a woman, so on the gender scale as well, she is disadvantaged in both ways. Rich men are advantaged in both ways as well. So, one can reasonably expect them to have sort of predictable trajectories in terms of, say, access to care. But the poor man and the non-poor woman, it's not quite clear how they are going to actually work, what their story is going to be, and that's because they each have a combination of advantage and disadvantage, so that it becomes entirely possible to leverage advantage from one axis to overcome the disadvantage of the other. Now, we did some analysis of this and we found that in fact non-poor women were very similar to non-poor men in terms of their ability to access care. And then we dug further, we realized that the poor men were able to actually leverage household resources, so that there was very poor health seeking among women in the poor households, but they were managing to get credit, they were managing in fact to leverage labor as well, household labor to their own advantage. And thereby get over some of the challenges to accessing care by virtue of being poor. Non-poor women, on the other hand, had class to their advantage, but they were disadvantaged by gender, so they couldn't access the credit market. All they could do was to access the labor of children or others over whom they had some modicum of control. And in that process managed to sort of get on to a level that was not very different from poor men. One of the non-essential readings up on Moodle is on this whole phenomenon of the middle groups. But the argument that we were making there is that the more intricate negotiations of power happen among groups in the middle of the spectrum, because they have some capacity to leverage, and leveraging is an important phenomenon in this whole process of negotiation. So gender seen intersectionally is actually quite fascinating, and it's, you know, certainly as research goes, it's a very interesting area of research, has immediate relevance to health policy research as well, because the recommendations emanating from it are rich and can sort of point in the direction of more specific policies. Now, in terms of the production of health, however, when gender is seen sectionally, and the intersectionality really has to do with social factors, not so much the biological, but the social factors actually get very interestingly constellated, and it is through that interaction between this rich constellation of social factors and biology that you get very interesting analyses. Now, for example, it was found in the US that black American women tended to have better birth outcomes if they were younger mothers. But as they grew older, then their birth outcomes started getting very adverse, and their health as well started getting worse. So, so this led to what is called the weathering hypothesis, which is that a combination of all of the cumulative risks that women have by virtue of being black women. So this doesn't affect men, obviously, but I mean, you know, maternity is a woman's issue. So by virtue of being black women, they come with poor health and a cumulative risk or a lifetime of stress and, you know, experience of discrimination, etc., and disadvantage leads to a weathering, so that over time, instead of getting healthier and better, they start suffering from poorer health. So the only time they can actually hope to have a good birth outcome is if they had their children extremely early, maybe in their teens, you know, which sort of goes counter to what one normally thinks or what one advocates in terms of policy. Similarly, from our own work, we found, for example, that in a context where health care has to be purchased from health systems, while gender bias sort of cut across all types of households, in terms of women's illnesses not being considered very serious, the phenomenon of what we call rationing kicked in when there were poor households. So, for example, it became entirely possible for both men and women to start up treatment, but women dropped out first before men from treatment, even though they were not fully cured because of financial difficulties. So here there was a question of households rationing resources and rationing it for men away from women. So this is what we call gender biased rationing. Now, if you have findings like this, I think in terms of policy, it becomes entirely possible for you to say, for example, that if we moved into a universal health system, then providing care to all would be the essential thing. It would allow poor women, for example, to continue treatment once they started, but it would still not address the problem of illnesses not being taken seriously, and that is more of a gender question, having very little to do with universal coverage. Unless over time there is more provider induced demand which allows women to get over the problem of the gender bias. So it means that there are multiple strategies that would be necessary, in fact, to make universal care a much more viable thing and a much more meaningful thing for women. One of the papers in your recommended reading is on the question of gender and universal systems. So you might want to look at that as well.